Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Muscle relaxants and the autonomic ganglia effects. So first is the stimulation. So when you look at stimulation, it is by the succinylcholine. Succinylcholine. Next is the block. So how is the block? So the block is provided by DTC. DTC. This will be strong. Next is the metocurine. Metocurine. This will be weak. Then comes the alcuronium. Alcuronium. Alcuronium will be also weak. Now we will look at which has no effect. So which one has no effect? So no effect is seen in atracurium. That is in atracurium. Then comes this atracurium. Then comes mevacurium. The vicuronium, the pancuronium, as well as the rocuronium. To learn and grow daily like this, please do subscribe.